The Deputy Director General in the National Department of Health says the country has an adequate supply of vaccines as the country continues to secure procurement of the CoronaVac and Oxford-AstraZeneca vaccines. We're now joined by the Health Department's Deputy Director General, Dr. Nicholas Crisp, to bring us up to date on the country's vaccine program. Dr. Crisp, a very good afternoon to you. Good to have you with us. So let's talk about the statement that has been made that the country has enough vaccines and will not be ordering any more, at least for now. What is the total capacity of vaccines that we have?
Good afternoon, Tammy, and good afternoon to your viewers. I thought I heard you mention a vaccine that we're not using at the moment. We have Johnson & Johnson vaccine and we have Pfizer vaccine in our use at the moment. And these are in large quantities, have been delivered since Thursday last week. So I think everybody knows by now we had a lot of problems getting Johnson & Johnson. There was a global problem with the supply of the active ingredient, and we for a long time didn't have Johnson & Johnson and were only using Pfizer vaccine. Now, Pfizer vaccine is a 2-dose vaccine, so it's less easy for us to use and means you need to buy more stock. But the Johnson & Johnson vaccine has been restored. We did receive a delivery last Thursday night, and then we get our weekly deliveries of Pfizer vaccine, which come from our procurement from Pfizer. And then we received this fantastic, huge donation of 5.66 million doses from the United States government, which the minister received on Saturday, and the second aeroplane load of that arrived this morning. So at the moment we are sitting with close to 10 million doses of vaccine, whereas last week we had under 1 million doses of vaccine left by the end of the week. So for now we have a lot of vaccine, and we are very happy that we are able to roll out quite fast now.
And at what point will the country need to procure more vaccines?
So there's procurement and there's delivery. We've procured over 70 million doses of vaccine, but of course it only gets delivered as we need it. So we still have another 29 million doses of Johnson & Johnson, which we have ordered. And we still have quite a lot of, off the top of my head, quite a lot of Pfizer vaccine still to be delivered before we get to the full procurement of over 70 million doses that we have purchased. Of course, the Pfizer vaccine, because it's 2 doses, means that only half the number of people get vaccinated, so there may be still some room for improvement depending on the uptake. But the Johnson & Johnson vaccine, the 31 million doses that we ordered, will cover 31 million people. So for now, we are comfortable that we are fine. We are not at this stage doing booster doses, and we are not vaccinating under the age of 18. So for the time being, we are fine. It doesn't mean that we are not looking at other vaccines, because of course the variants might change and there may be still disruptions in supply chain going forward. We are competing in a global market. So there's a possibility that we will need to look at other vaccines down the line. But for now, we are very secure.
So talk to us about word that government is looking at procuring CoronaVac and Oxford-AstraZeneca vaccines. What is the latest regarding that?
Well, procuring is a different step from evaluating the efficacy and making a decision on whether it would be a useful vaccine. So I think everybody knows that AstraZeneca was the first vaccine that we procured and then didn't use because it wasn't sufficiently effective against the beta variant. So that vaccine, there is still a registration for the vaccine in the South African Health Products Regulatory Authority. And there has been an application and an announcement made by SAHPRA that the CoronaVac, made by Sinovac, has been given a conditional registration, and there are conditions that need to be met. But it means that the first stages of that process are in place. There have been evaluations of these vaccines by the Vaccine Ministerial Advisory Committee, and an evaluation of the economics of the use of these vaccines by the National Essential Medicines Listing Committee. And those recommendations are with the Minister and government at the moment. And when it's the appropriate time, if it's necessary to procure vaccines from either of the or both of those sources, I'm sure that announcement will be made.
There is talk, Dr. Crisp, of a fourth wave. How will that fourth wave impact the vaccines in the country?
Yeah, well, if I had a crystal ball, I'd be able to answer that with more confidence. I think that from an epidemiological perspective, we all expect that there will be a fourth wave and maybe a fifth and a sixth. We don't really know when or how to, whether it'll be driven by a new variant or re-emergence of some of the variants we've already seen. But I think the evidence is that this pandemic does seem to come in waves. And based on what we've seen, it would come in round about November sometime. I don't think one would be more accurate than that. So before the end of this year, we may see another wave. Of course, we do know that this virus mutates all the time. And we don't know what the variant would be of the next mutation that we will have to deal with. Right now, the Delta variant that we're dealing with, the two vaccines we have are very effective against this variant. And we need to roll out as fast as we can, primarily targeting the older people who are the most vulnerable for serious infections and hospitalization, but also to get a larger number or a larger proportion of the population vaccinated that we possibly can. But we're on high alert. We have a lot of scientists in this country who are constantly monitoring what's happening with the virus. They're watching the genetic mutations, and they will give us a heads up when they start to see any changes taking place.
And what are your plans as far as the vaccination of undocumented individuals living in the country?
So from a public health perspective, it's really important to vaccinate everybody who would like to be and whom we can vaccinate, including people who are undocumented. But from a legal perspective, to vaccinate somebody without a record that you can refer back to, that creates a challenge. So we have been planning and are busy working on an alternative means of allocating an identity, at least a number, to people who don't have formal documentation through the Department of Home Affairs. So there's the formal process through the Department of Home Affairs, but then there's the emergency situation that we need to deal with from a public health perspective. But there's no reason why we are not able to provide a vaccine. It's just to do it in a responsible way that we have proper records.
And what are the timelines that we're looking at here for the commencement of such?
Well, we should have actually had that in place already, but because of the constantly changing environment, our team is pulled in many different directions and is consumed with other amendments to the system, vaccine management, and so on. So without putting my head on a block, we certainly need to be in that position by the end of this month where undocumented people can be vaccinated with a proper record. There are quite a lot of steps that need to be taken before we get there, though.
You spoke, Dr. Crisp, earlier on about booster shots. What exactly are those, and in what type of circumstances would they need to be administered?
So the way in which a vaccine is not a medicine in the sense of we give you something and it treats a condition. A vaccine is a biological product that stimulates the immunity of our bodies. We make the immunity, and it's our own immunity that fights off the viral infection. So over time, some viruses our bodies make permanent immunity to, but some of them they don't. And certainly from some vaccines, it's not a permanent immunity that we have. And we don't have enough history around the world, enough time to know which vaccines have how long they confer immunity in our bodies. So there are studies that are ongoing to determine at which point does the immunity wane, and when at that point it might be necessary to have another shot. I think you've seen this with other vaccinations, tetanus, for instance, we get vaccinated every 15 years. Some people would say every 10 years, but you do lose the immunity if you don't give a booster shot. So it may be that we need to vaccinate on an annual basis going forward until we get on top of this pandemic around the world.
We see children now, learners having gone back to school, including primary school learners as well. Germany at the moment is discussing the possibility of vaccinating children aged between 12 and 17 from next month. Is this a discussion that South Africa is having too, or discussions along those lines?
Yeah, we're nowhere near there yet. You know, you have to have vaccinated a lot of your adult population before you can start talking about vaccinating the children. There's plenty evidence that children are far less at risk. That's not to say another variant might not behave differently, but right now, the children are not the people who are at risk in the population. It's older people who are definitely those most at risk, by far, over the age of 60 and even over the age of 50. And that's the target we must aim for. We've crossed the 10% mark of vaccinations. We're on 7.5 million vaccines given and just under 6 million people vaccinated with either Johnson & Johnson or 2 doses of Pfizer. So we have a long way to go before we start talking about vaccinating children and doing other things with our vaccination program.
Dr. Nicholas Crisp, thank you once again for your time this afternoon. That's Dr. Nicholas Crisp. He is Deputy Director General at the Department of Health. Thank you, sir.